You know, this pandemic has been hard on everyone. Of course, first and foremost, those who suffered and been hospitalized. And of course, our hearts go out to the over 6,500 Coloradans who lost their lives, their friends, their loved ones. It's also had a major toll on all of our mental health, and particularly so many members of our youth. While Colorado was one of the leading states in returning safely to the classroom, nearly every student in Colorado experienced some interruption to their in-class education, some for one semester, some for a few months, some for most of the year. What this bill will do, and I want to thank Representative Michelson Janae. We're in her district, is that right?
That's correct.
Host district, chief sponsor, Representative Van Winkle, Senator Buckner, and Senator Woodward, who put together this bill, which will fund $9 million to Department of Human Services to really help meet students where they are for up to 3 mental health sessions to youth that are screened in the program. It was really a collaborative effort, legislators, our administration, professionals, to provide for up to 3 mental health care sessions for youth as we build back and power the Colorado comeback. These interactions will help our young people identify if they need additional support, where they can get it, help connect them to people who can help. This is a real transformative step in providing mental and behavioral health support to our students, and I want to thank the sponsors of the bill for their tireless effort to champion our mental health and well-being. I also want to thank many of the stakeholders that are here today: Mental Health Colorado, Democrats for Education Reform, we're here at Colorado's Children's Hospital, many others for their excellent work on this bill. It's a collaborative effort to address some of the mental health impacts of the pandemic. I'm proud to turn it over to Representative Michelson Janae.
Hello, thank you everybody for coming to this monumental day. Welcome home to Colorado's House District 30, home of the Children's Hospital. I myself am part of a Children's Hospital family, and I brought my son Eitan for show and tell. He is my why whenever I'm talking about my son. This is my son. When we started this legislative session, there was one thing that was very clear. We were starting to do a very good job as we rolled out the vaccine, and it looked like school was going to look normal when we came back in the fall. But many children have been impacted in ways that many children have been impacted by COVID in ways that are going to leave lasting scars if we don't address them soon. If we address them soon, they don't need to be lasting scars. We can get our kids the help that they need as quickly as possible. And this piece of legislation, which is an unbelievable coming together of all of these amazing people that you see back here, is the pathway to do that. When I started the legislative session, a journalist asked me, so, what is your goal this year? What do you want to do? And I said to him, well, I want every school-age kid in Colorado to get a mental health screening before we go back to school. And of course, he looked at me like, sometimes I get that look when I tell things to journalists or maybe the governor's office, a little rolling back of the eyes. But instead, this time, I got a call back from the governor's office that says, Director Werthwein actually has some really good ideas here. And what you see before you is the compilation of those good ideas, stakeholdered, worked with the community, and we are here to help our kids. What I would ask of you is we need your help to spread the word in your communities. When this becomes live, and certainly I'll be screaming it from the rooftops, but when this becomes live, we'll need your help to tell children in the community and parents in the community that this tool is available to them free of charge. And we are here to be their community and wrap our arms around them so that we can get back to school in a healthy and safe fashion. So thank you, Governor, and I am turning it over to Senator Buckner.
I am so excited. This is definitely a monumental day. I am not, you're not in my Senate district, but Children's Hospital borders on my Senate district. So I'm going to claim Children's Hospital as well because they are phenomenal and the work they do is phenomenal. And when I saw the article in the newspaper about Children's Hospital's concern for the mental health of our children, I was even more proud to be a co-prime sponsor of this important bill. You know, many of my emails during the pandemic were about the mental health of people's children, and that includes my own family. So this is crucial, and we do want you to spread the word, and we will be doing the same. Senator Woodward couldn't be here today, but he just sent me a text to make sure I told you that he believes, just as Senator Buckner believes, this is the most meaningful bill of the session. So thanks for being here today. Thanks for the support, and we will definitely spread the word about this bill to make sure that as many youth as possible can take advantage of the mental health that we are going to provide. So next I'm going to introduce you to my friend Representative Van Winkle.
Thank you, Senator. It truly is one of the most important bills of the entire year. My sincere thanks to Governor Polis and, of course, the senators who carried the bill, and biggest thanks, most of all, probably to Representative Daphne Michelson-Janae. Her and I have been working for several years on addressing mental health in our K-12 education system, on school safety and other important issues. And this bill is a capstone of that work, so to speak, because this will save lives directly. It will save lives in many different ways, and as Colorado transitions beyond COVID-19 pandemic, the state's youth need the support of their parents, families, communities, and mental health professionals beyond the school walls to address the pain, trauma, and loneliness they are experiencing. We heard just yesterday that Children's Hospital declared a state of emergency, and this bill answers that emergency where it matters most, which is for our youth of Colorado who need the help that this bill provides. So thank you, Governor. Thank you, Daphne. Thank you, Senators.
We have we have several stakeholders who can speak as well.
Yeah, and thank you, Governor. Let me introduce Dr. Robert Worthwin. Sorry.
I'll make this quick. I just want to say that Colorado Department of Human Services and the Office of Behavioral Health wants to thank the governor and our sponsors and Michelson Janae for staying on top of this and making sure that this was going to go through and that we're going to be successful. The governor has charged us with starting a behavioral health reform in the state of Colorado. We will do better by kids in Colorado, and we're going to do better by kids in Colorado. And this is one of the key platforms of launching off our behavioral health reform in the state of Colorado. We're really excited. We do need our partners to help us out. This is going to be a massive lift. It's not going to be perfect, but it's going to help a lot of kids across the state, and we're really excited. There are too many kids that are their call for help is going unanswered, and we're really excited, and we really want to work with our partners to make this successful. But I think important, we want to hear from our young people and our young adults and their voices. So with that, I'm going to introduce Katia Morcheko.
Hi everyone, I'm Katia Morcheko. My pronouns are she, her, hers. I work for Colorado Department of Human Services, Office of Behavioral Health, and I'm their youth advisor / coordinator. We're not clear on that yet. And I got to testify in the first round of this bill, and this bill holds a very special place in my heart because on March 20th, I lost a friend to suicide of 2021. And then March 22nd, we had the Boulder shooting. So I also have my two Ys, which are my two younger brothers, a 17-year-old openly gay man, which in the Hispanic culture, you know, was still working with the stigmas and acceptance. And my 13-year-old little brother, who is just, you know, something else. And you know, I talked to him very eloquent about mental health. I talked to my mom about mental health. My father still does not believe mental health is a thing. So I'm here because I want to represent my Latinx community and say that it's time for us to talk about mental health. It's time for us to get help, and access to it is the first step, and this bill allows that, allows access for young adults in Latinx communities. You know, it's a hard thing to talk about suicide, but it needs to happen and we need to prevent it. And this is a huge step to removing that stigma. So I really wanted to thank Office of Behavioral Health for also involving me in this. And I can't wait to help others know about this, inform them, inform my community. And thank you all for your support. Thank you, Governor, for signing off. And I wish I had more to say, but I'm so nervous. But thank you so much for your support.
Rosie?
Oh, now with you guys, here is Rosie Guzman.
Woo, it's hot out here. Hello, my name is Rosalinda Guzman, and I'm a leader from Below the Surface campaign for Colorado Services supporting teens and young adult mental health. Today, I want to thank Governor Polis, legislative leaders, and mental health advocates for stepping up to help youth and young adults address mental health needs. This has been a hard year for students like me. From being online to hybrid to finally back in school, but being quarantined continuously, we have been challenged to maintain a sense of normalcy when nothing has been normal at all. A lot of teens felt pressure to stay safe and healthy, but also get their work done. At times, it felt as though teachers were starting to give up and lose hope for the rest of the school year. Unfortunately, with being stuck home, I found that having a good work ethic became more difficult. We felt like we were missing out on our most fun years and developmental years, too. We've endured so much traumatic experiences. Luckily for me, I was able to join Sources of Strength, a suicide prevention group that led me to Colorado Crisis Service program. Through this program, we share our stories and experiences to hopefully reach at least one person. I would like to inspire young adults and teens to take care of their mental health and have a balanced and healthy lifestyle. Even though the pandemic is almost over, the scars from isolation could still cause mental and physical problems down the road. I know from my own experience with mental health. The mind affects the body constantly. For example, being hungry can cause you to lash out and be somebody you're normally not. So what does it mean to be mentally healthy? For everybody, it's different, but the main things to remember are to eat healthy regularly, drink water for your body weight, get plenty of sun, and take time to exercise, even if it's just a little bit. Maintaining good hygiene, doing hobbies you love, and reaching out to loved ones to check in will allow you to also stay mentally fit. I want to speak to the young people out there listening today. If by chance you are in a mental crisis, the first step would be recognizing that you need help. Colorado Crisis is a service for teens and young adults to reach out to by texting or calling. This is an amazing resource to start with. You can also choose to talk with a trusted adult about what is happening in your life. I also believe that everybody should have therapists. Life is not always a walk in the park, so having someone to talk to and help when times get hard is always a plus. Therapists are licensed and meant to help you during any times of your life. Now that the state government is funding sessions and making it easier to access therapists for your teens and young adults, I encourage everyone to take advantage of this free help. Overall, this pandemic year has been a challenge for almost everyone. The uncertainties are weighing on many shoulders and a lot of stressors keep occurring. If you are a young person like myself, it is important to think about your mental health amidst all of the chaos. I am so grateful that all young adults will have access to free, confidential therapy. Thank you so much for supporting Colorado youth as we rise above this crisis.
Well done, Rosie.
Thank you.
Okay, let's sign the bill. Just be careful not to step on the dog here. Here we go. Ready to make it official?
Do it.
Okay, we use 4 pens here. So. Perfect. Going to the sponsors. Finally, and it's official.
Yes.
Law of Colorado. Congratulations. Representative, and we'll get this one to Rob Woodward. So
Thank you.
Thank you so much for joining us. Yes, this is very exciting bill. A lot of this is some of these people will be able to take advantage of.
I hope so, yeah.
Thank you.
Rob, thanks for your work on this.
We got a lot of work to do.
Common interest, I suppose.
You have a financial?
All right.
I do.
Second bill? We have another bill to sign. This one is Representative Amabile, Representative Young, Senator Kolker, and Senator Zenzinger. And yes,
Never mind, he did.
thank you. Thank you for joining us. We've seen a lot of you lately.
It's good to see you again.
I also want to acknowledge Ray Merenstein from Ed Nami and Christine Bonero from Mile High United Way. I want to thank them for the work on the bill. We're also joined by Dr. Rob Worthwine once more. The COVID pandemic and the global economic aftermath affected many people's health, and that included creating new barriers for people that already suffered from mental illness and substance abuse disorders even prior to the pandemic. And another key driver of mental health issues is economic instability. And we were so thrilled that the General Assembly, under the leadership of Mary Young and Senator Zenzinger and Representative Amabile and Senator Kolker, designed a program to help Colorado youth enhance outreach, provide information to help people who are unemployed and access behavioral health services in their time of need. This bill makes sure that we can build on the success and visibility of our 211 effort by hiring and training specialized personnel that can then refer people to behavioral health services. These funds target outreach, including to traditionally underserved communities, so that people know how to get help. Once again, I want to thank Mile High United Way and Christine Bonero, Ray Merenstein, and the sponsors. And with that, we'll turn it over to Representative Mary Young.
Thank you, Governor, for signing this bill today. Too many Coloradans are left without options or without even a phone number to turn to when they need behavioral health care. We're going to change that. In existence since 2002, the 211 hotline is a multilingual communication system already helping Coloradans connect to important services such as housing, food, safety, and health services. My office in House District 50 in Greeley relied on 211 to successfully connect my constituents with needed service throughout the pandemic. 211 helps people navigate over 8,000 health and human services across the state, supported by 2,800 agencies. These services are often a combination of public and nonprofit services. As the governor said, this is going to provide expanded services in the 211 system and really targeting underserved and underemployed individuals. So when we ask the question, who you going to call? 211.
Thank you. Senator Kolker.
Thank you, Governor. Thank you, Representative Young. For the 211 system is important for me in expanding it to behavioral health because it's one of my own personal issues. It's an issue that's close to my own heart, dealing with behavioral health and mental health. That's something I've made known publicly since I was once a young boy dealing with mental health issues. It is just one aspect of the whole universe of mental health that we can provide services to. 211, as stated before, will expand behavioral health connections, especially to the unemployed. That was our goal initially when we decided to do this bill, was make sure that those in unemployment services, those unemployed for the last year and a half, know what's available to them. And I appreciate the governor signing it today because I do believe it will have an impact, again, as part of the overall mental health universe. So thank you.
Rob, you want to say a few words, Rob?
Thank you again, Governor, and our bill sponsors for sponsoring this bill and supporting this bill in the General Assembly. The Colorado Department of Human Services and the Office of Behavioral Health are very excited by this bill. We know there's a direct relationship between joblessness and suicide rates. The evidence is clear, and this is a great step in curbing suicide rates in the state of Colorado. So we're very excited. We think it's going to have a lasting impact, and not only a lasting impact, but this could be a start of a service that we could see in the state of Colorado going forward. We know that the behavioral health system is very complex, and we're very excited by this effort because we think this will make it easier for Coloradans to access behavioral health care, and that's our goal at the end of the day, is to get more people behavioral health care in the state of Colorado. So thank you, Governor, and thank you, bill sponsors.
Thank you. And Christine Bonero from Mile High United Way.
Thank you. Thank you, Governor. Good afternoon. I am Christine Bonero and have the privilege and honor of serving as the president and CEO of Mile High United Way. And I love that 135 years ago, Coloradans came together during another kind of pandemic to say, how do we wrap our arms around our community and how do we be there? And here we are 135 years later, coming together, uniting as a community, which is why today's bill is so incredibly important and so incredibly exciting. As you heard, 211 is a confidential service that connects people to resources and services within their local community. It is one phone call. During at the start of the pandemic, I was so grateful to Governor Polis, who understood the power of 211 and truly said, I think we need to be there for Coloradans. Pre-pandemic, Colorado's 211 was taking about 300 phone calls a day. At the height of the pandemic, we were taking 2,000 phone calls a day from Coloradans, our friends and our neighbors, calling for rental assistance, childcare assistance, utility assistance. But what we're seeing now more and more is the stresses that the past year and a half has brought to all of us and to all families. And 211, because of these amazing visionary bill sponsors today and because of our governor, it is going to be one place 211 can call. So to our bill sponsors, Senator Coker and Representative Young in particular, on behalf of all of Colorado, please help us get the word out. 211 will be there for you for all of your resources. And now, because of today, we'll be able to support the mental health and the behavioral health of all of Coloradans. Governor, thank you so much for your leadership.
Thank you. Let's sign the bill. Here we go. It's official. The law of Colorado.